cough differential diagnosis, very frequently tested on the USMLE. So cough, the way you go about the workup, it's going to be based on child and adult. So for an adult, it's less than 3 weeks is acute, 3 to 8 weeks is subacute, and more than 8 weeks is chronic. So the differentials are, and for a child, it's actually more than 4 weeks you need to do a workup. So for the adults, the differentials, the most common ones that you should be thinking of is asthma, gastroesophageal reflux, and then upper airway cough syndrome, and always medications like ACE inhibitors. So once you rule those out, you can start your workup. So if it is reflux, you give them proton pump inhibitors like omeprazole. If it is asthma, then you need to do this pulmonary function test, and you can treat them with the step-up treatment for asthma. If it's upper airway cough syndrome, often they'll tell you on the physical exam, it's cobblestoning appearance of the oropharynx. And also, if you give them an H1 blocker, the symptoms will be resolved. And another thing in the physical exam they'll tell you is there's like a dripping in the back of your throat. So cobblestoning appearance of the oropharynx, the dripping sensation at the back of your throat, and they also end up having rhinorrhea and maybe allergies and stuff like that in their history as well. So the treatment for upper airway cough syndrome, there's 2 options. You can give the histamine blockers, first generation, second generation by themselves, or you can combine it with the decongestants. So if you do the combo, some examples are brompheniramine and pseudoephedrine. The first generation blockers are going to be, of the histamine blockers, are diphenhydramine, diamine hydrate, and chlorpheniramine and doxylamine. These are sedating, and they're antimuscarinic or anticholinergic, and they're anti-alpha. So those symptoms, for a quick review, are anti-alpha means if you stimulate alpha, it causes vasoconstriction. So you want something that is vasodilating. Antimuscarinic or anticholinergic is opposite of the dumbbell symptoms. The dumbbell symptoms, I use something called dumbless, which is probably not even a word, but it works for my mnemonic. It's DUMBBLESS for cholinergic toxicity. So everything that's cholinergic toxicity, opposite is going to be the H1 blockers. So the cholinergic toxicity causes diarrhea, urination, meiosis. It causes bradycardia, bronchoconstriction, lacrimation, excitation of muscles or CNS, sweating, and salivation. So everything opposite is going to be more dry. You won't be able to urinate, you won't be able to sweat, produce tears, and so forth. So these are sedating though. So if you want them to be less sedating, then you consider H2 blockers. Those are going to be loratadine. There is desloratadine, fexofenadine, and cetirizine. So once again, I apologize in advance if I'm pronouncing something wrong, but this is just like a quick review if you're looking for differential diagnosis of cough and how to go about the workup. So these are far less sedating. So in adults, that's how you go about the workup. You start with ruling out these differentials, and then you say, okay, I can do chest x-rays and pulmonary function tests. But in children, if it's more than 4 weeks, you begin with the pulmonary function test, the spirometry. And if it's showing you a reversible airway disease for like asthma, then, and how do you know that it's a reversible airway disease? Sometimes they give like methacholine challenge test or histamine challenge test. And when you do that, the forced expiratory volume, one of the parameters in the spirometry, it goes down by more than 15% or more than 20. And that confirms like a asthma, an obstructive airway disease, but it is reversible. Then you go ahead and give them a short-acting beta agonist. So that's going to be albuterol. And the other combination, so you give them albuterol along with a steroid, inhaled steroid. And you can treat them for the step-up treatment of asthma. But if they don't have reversible airway disease, the next step to do is chest x-ray. Or if you thought they did have the reversible airway disease and you gave them the treatment and it didn't work, then you have to do a chest x-ray as well. So that's a quick review. Hope that helps.